It's awesome. Hello, everybody. Happy Wednesday. It feels weird because with the holiday on Monday, it doesn't feel like Wednesday, does it? No. I don't know what day it is, but it is Wednesday officially. And we are coming at you live from Peoria Life. I'm Kim Martin and with Healthy You. And our goal every week is to really just share with you, educate, inform you of anything that can help make living a healthy lifestyle just a little bit easier, because it is one of the hardest things to live a healthy lifestyle. There's just so much coming at us. And of course, one of our monthly expert guests is Preferred Care. Usually, Dr. Carrie Musselman is here with us, and she just had a baby. And so, of course, Tarah is going to be filling in for her today. Tarah Gibbs. Yes. And you are a nurse practitioner for Dr. Carrie at Preferred Care Medical Center. And so we're talking pain today. Which I thought was an amazing topic, because as soon as you guys emailed me and said, let's talk about pain and treatment for pain, I thought, oh my goodness, this is perfect, because one of the things I hear all the time at Curves is people are afraid to exercise because they're in pain, or they've been in pain and now they're not. And it's just very difficult to do anything when you're in pain. That's the bottom line. Even if you get a little headache.
Definitely.
So we were talking before we went live, and you said that one of the things that you love about working for Preferred Care is the holistic aspect of it.
Yes, definitely. The nice thing about our office is we look at each patient individually, and we don't just examine the symptom or the pain or what they came in for, but we look at them as a whole. When they first come in, we do an exam on them and get a really good history to find out what they've tried for pain, or what's failed, or what they're currently trying. And once we have a good idea of that, we get any x-rays that we might need or any testing we might want. And then we meet with the whole staff to discuss each new patient.
Which is awesome. Not to interrupt you, but that's one of the beauties of what you guys are doing at Preferred Care. When you say you meet with the whole staff, you've got physical therapists, you got doctors, physician's assistants, nurse practitioners, and so you guys come together. And chiropractor, Dr. Carrie is a chiropractor.
And we have the chiropractors, and then we all together look at this patient and go over their history and what they've tried, and their nutrition, and current medicines, whether they've tried physical therapy or pain medication or surgeries. All of those things we take in consideration when we're treating someone for pain. We look at those x-rays or MRI or CT scans, and we look to see, what's going on inside. What are the bones looking like? What could be causing them to have this pain? And then together we formulate a treatment plan. And the nice thing about the treatment plans that we would discuss on a patient, we give options. So some people, prefer not to do the holistic route or the natural route, if you want to say, and they want to go more the traditional medicine route, and we can do that too. So it's nice to meet with a patient and not say, okay, this is what we're going to do, but to have a discussion with them and be like, this is some options that we think would benefit you. How do you feel about them? And which avenue would you prefer to try first? And they always appreciate that, because as a provider, chiropractor, we're meeting this patient for the first time. We don't know their life. We don't know their dynamics and what's
their pain tolerance.
Yes, we don't know what's going to work for them, and their mindset, and where they're at in all this pain. And by having that conversation and leaving it open and really working together rather than working one-sided, we find that our patients get better faster that way.
Because they feel more comfortable. We were talking, you were a labor and delivery nurse.
Yes.
That's what you did before you went back and got your master's and went on to be a nurse practitioner and started working at Dr. Musselman's office a year and a half ago, you said?
Yeah.
But The same is true. Everybody's pain tolerance is different. You know, I know when I had my babies, I'm like, give me the epidural. I was not even thinking
And there's
natural.
nothing wrong with that.
But there are women that want to do it natural, and they're better that way because they're less stressed, and it is different for everyone. So it's awesome that you're able to just make it work for the individual person. You were saying that you guys have this new treatment, that you're one of the only offices in the area that does this treatment, and help us understand that, because when someone's in pain, finding that root cause is very important. But what's this ear thing you were talking about?
Okay, so I won't get into the real science of it because it can get a little confusing, but the way that it works is it's a device. It has 3 little batteries in it, almost like hearing aid batteries.
Okay.
And it just places right behind the ear. You can wear it 4 to 7 days, depending on how long you want to wear it. I find that people start with 4, and then they realize how much it's helping them, and they're like, I want to go to 7 because I'm getting so much relief. And then we use, you've heard of acupuncture and the points in the body. So the ear is our map to our body, and there's points in the ear for the whole body. So depending on where their pain is, are the points that we use in the ear to place the wire. So it's a little wire that wraps around, and on the end of this wire is about half the size of a thumbtack of a needle. Okay. So it does puncture the skin right underneath the skin. It's not deep.
It's
I don't
not
want
like
people. No, I don't want people to think it's like
you put pain in your ear to get rid of the. It's kind of like hit the thumb with the hammer, get rid of the pain.
No,
it's not like that, right? Okay, so it's not.
No, most people don't even feel it when I put it on.
Okay, so it's just under the skin level.
Right,
but you got to have that.
We got to have that conduction.
Acupuncture does. I've never had acupuncture, but I've heard it doesn't hurt.
Yes, and so with that device on, depending on where their pain is where I'm going to place those tiny needles on the ear. And so we'll just say, if someone's coming in with fibromyalgia,
okay,
I'm going to place based on the fibromyalgia points on the ear. And then we tape it down for them. And again, they can wear it 4 to 7 days. The nice thing is that this battery that we have in the back sends an impulse up to the points that we have in the ear. That goes to our brain to help stimulate and say, block that pain cycle, block that pain. Don't let that go to the brain saying it's pain. Okay?
Oh, wow. So that's why it's more natural, because you don't have to take the medication to cover the pain. This is just kind of like blocking.
This is, and it's treating the pain in the sense that we've tried everything. We've tried physical therapy. We've tried, some people even had surgeries. We've tried narcotic pain medication, tried all of these options, and nothing's helping. And this is an amazing choice for those people. I have had amazing results with fibromyalgia, back pain, sciatica pain. I've treated someone for phantom limb pain. I've also treated someone for essential tremors. So it's not just pain that it can treat. There's other conditions that it can help manage too.
So by placing this on the trigger points in the ear, it sends a signal to your brain to not feel the pain or to revert it from the whatever it is that's
saying that you're
stimulating your brain at that particular time. Wow, that's amazing. Pain is traumatic.
It is.
On the body, isn't it? And so if you can get someone out of pain, you can relieve a lot of stress. What kind of results come from when you are in pain? The results of that stress on your body, like
it changes. What I like about it so much is I can have a patient come in extreme pain, and they feel really desperate because they've tried everything, and they don't know what to do, but they want their life back. They just fight to get through the day, and they're missing out on events with their families, and they're missing out on life, they feel like, because this pain rules their life. It tells them what they can do. It tells them, how you're going to wake up, what attitude you're going to have for that day, depending on how bad your pain is. And so what's nice as a provider is I get to see these patients come in that way, and then after each treatment, you start to see the shell come off, and
you see it off their
you
face. I mean,
do.
like we have a lady, a member at Curves, who just had her hip replaced, and before she was in such pain. And Melissa, the coach, the other day was like, "Look at her. You can just see the pain is gone. Like it's like off of her face. It's amazing."
It is, and they're so thankful that
Yeah.
you take the time to help them, because sometimes they feel like there's nothing, nobody can help them.
Yeah.
And they lose all that faith and hope that they will be pain-free someday.
So don't lose hope.
No, don't.
So if you're listening and you're in some pain, you've tried things, there are more options. Keep searching. I want to encourage you to reach out to Preferred Care, especially come talk to Tarah. You do those treatments. Tarah's the nurse practitioner on site there. But maybe you're watching and you're not in pain, but you know someone who is in pain. Could you share this? Shoot them a text and tell them, log in, watch this video, or come back to Peoria Life a little bit later today, and you can watch it later as well. And ask some questions. If you go on the comments and ask questions, I know that, Tarah, you can come back later and answer those questions for them. So maybe you have a certain type of pain that you've been trying to get treatment for and just haven't had any luck. Science is coming a long way. Like, that is incredible now that you can. That makes sense to me, because I know we were talking about this before the show started too, how your brain can only feel like you'll have the worst pain somewhere, and that's what your brain triggers the most. You might be in pain in other areas, but you don't know it.
And that's what I find with a lot of patients is they'll come in complaining of we'll say hip pain, and then once we treat the hip pain with the neurostim, they find, okay, well, now I'm having pain in this area. And so it kind of pulls back those layers again to say, okay, well, let's treat your worst pain. What is interfering with your life the most right now, and let's treat that first.
Right.
But you can use the neurostim to treat different conditions after that initial one. We can treat again and go to a different area of the body.
Because like you said, you just move that around.
Yes.
So that's one option. Now you guys also do some physical therapy and things like that?
We have physical therapy, we have massage therapy, and then we have chiropractic. What's really nice is if we have someone come in that's in really acute pain, we're able to give them a lot of different avenues to help get this pain under control. We can not only, offer the neurostim, but we can also offer chiropractic care with that, massage therapy, physical therapy. And so I find by using all of those tools on the patient, they get better faster, and they get out of pain faster, because we're able to hit it from more than just one direction.
Right.
And it's just amazing to watch people just get better.
You guys are able to write prescriptions, even if you need to. And like you said, working, I mean, it's like everything under one roof.
It is.
It's which is awesome. I love that. I love that concept, right? We do that with I've Decided. I love that with Curves. And I love the concept of having everything under one roof.
It is. It's really nice. And the patients appreciate it, because they don't have to go from one office and say, okay, well, I need my records to go to this office because I'm going to now do chiropractic care, or I'm going to do physical therapy. It's, if I have a patient that can benefit from physical therapy, that first initial exam, I order physical therapy, and they just go.
They're right there in the same office. And then insurance too, right?
Yes, we take insurance.
So you take insurance, but then with all of that under one roof, they really, because you don't have to go anywhere else. Like, honestly, you can have your nurse practitioner, your physician assistant.
And we treat, I have patients that come to me for primary care.
Right.
So, I mean, it's anything from women's health children all the way up to adults, just anything that you would normally go to your primary care doctor for. So sinus infection, managing blood pressure, high cholesterol, all of those things. And again, with managing those different conditions in people, we again get to offer them other routes besides traditional medicine. If we want to try a supplement first to see if we can bring down your cholesterol with this supplement before we go straight to a medication,
Right.
we can offer them some other avenues
Yeah.
too. So
Are there any limitations that you have where you would need to refer them to a doctor, or you can do you can take care
most
of
things, yeah.
most things right there in office? That's awesome. Like just being able to go to your doctor's office for a sinus infection.
Sure.
Oh, and get a massage while you're there.
Hey, why not?
Right? Because if you get a massage, you work in those areas, sinus areas in your neck and back that can actually
yes.
relieve
It
sinus
can.
pressure.
It does. Patients, usually when they come to me for something acute, most of the time I'll be like, if you can make time to get an adjustment, it's really going to help your body heal and help align everything. And one example is, especially the season it is now, the kiddos with ear infections.
Oh yeah.
This is the season for that. And usually I'll see a young child for an ear infection, and I'll recommend trying chiropractic care, just to help put a little angle on that eustachian tube instead of everything just sitting in there and brewing infection. And I never see those kids again.
They get well.
They do chiropractic, and I see them when they come in the office, but they don't need me anymore.
But that's a double-edged sword, right? Because that's what we want.
It is what we want.
We want you to be well. We want you to be healthy and pain-free. Like I just, even just a silly little headache can cause
definitely
trauma and disturb your routine. And, I thank God that I don't have to, I can't imagine like someone having migraines every day
it's debilitating. It really is.
So what about migraines? Do you guys, does that help?
We do.
What you were talking about with
the neurostem.
The neurostem. That's what that neurostem. Remember that. That's what that's called.
Yes.
And that has helped with migraines. Oh, wow.
It really has. There's an array of different conditions that we can address with the neurostem. We usually start with the pain because that's a huge thing that a lot of people deal with. And so pain is usually where we start.
Yeah.
But it also does, like I was telling you, essential tremors that a lot of people have.
Like tremors associated, I was going to say like associated with Parkinson's and things. It's helped with that too.
Yes, it does.
Wow.
It's been amazing to watch this work for people.
I bet.
And you can go, on our website, on our Facebook post, and we have patients that are giving testimony to how it's helped them and how it's, given them their life back. And
speaking of walk someone through, like if they're watching now and they're thinking this sounds really incredible, I'm interested. Walk them through how they need to get in touch with you and what that would look like.
So you just call the office and tell them that you would like, a free consultation to talk about the neurostem. And I'd be happy to meet with you and discuss it and show you what it looks like and talk to you about your experience and where you're at in life with your pain and what you've tried and your frustrations and talk about how this can help you. And then I also want to get a really good history from you and find out what medications are you on? When did this pain start in your life? And how long have you been trying to manage this pain? All of those are really important factors for me to consider when we just, give you the options of what we think is the best route to manage your pain.
Okay.
And then from that consultation, if it's something that you think that you want to try, then we make an appointment for you to come in, and that's when we do the full exam.
Okay.
And, heart, lungs, just do a regular exam.
Blood work.
Yes.
You guys can do all of that. I think most people aren't used to having that kind of service all in, it's not just a chiropractic office. That's why the title, Preferred Care Medical Center.
Yes.
Because it's really, it's not just a chiropractic office. That's a piece of it.
It is, definitely.
I mean, Dr. Carrie is a chiropractic doctor, and so she's on staff.
Yes.
But you're on staff.
Yes.
And you're a nurse practitioner. And you have massage therapists on staff and physical therapist assistants on staff. And that just, I love that.
It works really well. And then once we do the exam, then we set up the time to come in and get it placed. It takes me 10 to 15 minutes to place this device. So it's not something that is a drawn out process or that you got to jump through a lot of hoops to get there. We'll also, check with your insurance, see if they will approve this.
So sometimes even insurance can approve this device. That's awesome if that would help people for sure.
Medicare too.
Okay.
Definitely. So we make sure that we put all the pieces together for you so that you know this is the cost that it's going to be to you, because our goal is we have to work around everybody's budget. Everybody has different things in their life that is going to decide which avenue they're going to be able to take.
Right.
And we understand that.
Sure.
And so we want to make it affordable for them also. And we really care about their pain. We really want them to get the best treatment possible. And I think our patients, when they come, they get that.
They can tell.
They always get a hug when they come in, and they always get one when they leave. And we really care about them.
And you guys are located in Peoria, out at our favorite shopping center, Junction City. Give a plug for Junction City, because we really love them and what they do in our community. And Alexis Kazam and his family do so much. They support us and just really are great community movers and shakers. I say they're doing great things, and that shopping center is awesome, and it is packed out there.
Yes.
I mean, the cars are just everywhere. So that's where you're located in Peoria.
That's one of the locations.
It's a beautiful location too. You got to go out there and check it out. It's awesome. But you guys have 4.
We do.
All over.
We have the one at Junction City.
Okay.
And then our first office was in Eureka. And then we have an office in Roanoke and El Paso. And all of those locations have chiropractors, have people to help with physical therapy, and then also a nurse practitioner.
Right. Okay.
So, and the nice thing about the offices too is, when we're open, if you have an urgent care, something come up, the kiddos get sick or you get sick, you can just walk into the office during business hours, and we'll fit you into our schedule.
Oh, wow. So, like a prompt care almost.
We do, because things come up. And if we can, help get you in and out faster than waiting long times, either in the emergency room or at an urgent care or prompt care, because we've all been sitting there for hours.
Forever.
So if we can help with that, we do.
Now, do you guys offer flu shots and things like that?
We don't do vaccinations.
Okay. No vaccinations.
We usually refer people to your local health department for that. They usually have the best prices to get patients also. For those, and now they're submitting to insurance too. The health departments will for you too.
Oh, wow.
On your vaccination. So that's nice.
That is a nice thing.
Mm-hmm.
Awesome. So what other? So that's your favorite.
That is
because that's what you're seeing the best results.
It is.
But a lot of times a simple adjustment can.
Yes.
I've seen people where I'm like, you're crooked. They're like, my hip is hurting. I'm like, you're crooked. Your shoulders are like this. And I'm like, you need to go get an adjustment. Because that song, right? The hip bone's connected to the knee bone.
It's all connected.
So isn't it amazing that when someone can be off here, can actually cause the opposite hip to hurt, and then you think you have hip pain, but the core root of the problem is coming. It's called, what is it? Referred pain.
Yes, it's it's always interesting when people first come in and they're complaining of just lower back pain or neck pain, and once the chiropractors get in there and start adjusting them, that pain eases, and the actual where the start of that pain starts to make its headway,
Yeah.
then they can really get in there and treat, okay, so it started here, but then it went to here. So it's again working with that patient, peeling back those layers to find where is this pain really coming from.
Because you might have referred pain.
Definitely.
Can you help the listeners understand what referred pain means?
So that's just like, say that you're having hip pain, and that's where the root of your pain is, and you're walking, say that you're walking funny. You don't realize it most of the time that you're, say, babying that hip or that knee. And by doing that, we throw our whole body off alignment, like you were talking about. And so that can cause pain in a lot of different areas. And so that can affect the other hip. That can affect your low back.
Or your knee.
Neck,
like
knee,
if you're,
yes.
I know I thought I had a knee problem one time. I'm like, oh no, I got a, because I run and my knee was just killing me. I'm like, I got a knee problem. Something's wrong with my knee. And it wasn't my knee. It was my IT band that connected to my knee.
Definitely.
So the referred pain was coming out in my knee. Sometimes
we're our worst enemy, and when it comes to pain, because you want to rationalize it. You want to say, okay, this is pain because I did this, or because I worked too hard in the yard this weekend, or this, and we try and to just put that cause on it and move on, because now we know why it's there. When a lot of times that's not why. And so being really open-minded when you come into the office and say, okay, so this is a big picture of my pain, and try not to just focus on, okay, so it flared up this weekend because I worked in the yard. Well, did you have some pain before you worked in the yard? Is it something that bothers you every once in a while? Or, looking at that big picture is really important.
Yeah.
To have the fastest avenue to get them out of pain.
And the inflammation too.
Definitely.
The inflammation can cause that referred pain.
Yes.
So and that's what happened, like I was saying with the IT band. My IT band was inflamed at the point where it was connected to the knee down low, and it was causing that pressure because when you have inflammation, that presses on the nerves.
Definitely.
So getting out, and again, the massage therapy really can help with
really helps.
Inflammation. Are there any natural like vitamins and supplements that we can take to help with inflammation?
We do. We use Standard Process is a really good brand, and we also use Orthomolecular is what we have in the office.
Okay.
And there is a supplement called Ligaplex by Standard Process.
Ligaplex.
And we try and get people off ibuprofen or Motrin and get them on this Ligaplex because it's a whole food vitamin. So it comes from food that we eat, and our bodies are designed to get those nutrients from our food.
Yes.
And unfortunately,
that's another good show we should talk about.
Yes.
Healing your body from
food.
Nutrition. Yeah.
And nutrition is huge. And not what I try to stress to patients when they come in. My goal is to sit here and sell you vitamins. My goal is to get you healthy the fastest, get you out of pain the fastest. And I can speak to what I've seen other people has helped, what has helped them move past this. And a lot of times, the Motrin, ibuprofen, those things are causing more harms to your stomach. People get upset stomach with it. Yeah. There's lots of downsides to that. And our body, Motrin is not something that our body recognizes as food or a nutrient.
It's a foreign substance.
It is. It's a medicine.
It's a foreign substance, and so it's created in a laboratory in your body.
And not to say that there's not a time and a need for it, because I always stress that to people that, having trained in medicine and working in integrated health, there is a time and place that we need medicine, and I understand that and completely. But it's always nice to be able to try some supplements or some whole food supplements that our body recognizes as nutrients and knows what to do with them.
If you can go the natural way, if that is an option, that's always the best way. And I think everybody would agree with that. But obviously, sometimes you need some medicine, and we don't want to downplay that at all.
No, not at all.
But certainly there are times when you can go a healthier route. So, hey, I can't believe it.
I know.
Is that
my
like
fast.
the fastest 30 minutes of your life or what? Like, it's like the fastest 30 minutes ever. We're down to a minute. And first of all, thank you so much for tuning in. Be sure to share, comment, show us some love. Let us know that you watched the show. Ask some questions. So Tarah can come back a little later and answer those for you. And give Tarah a call. Don't live life in pain. There are options. And like you said, you guys have this new maybe solution for a lot of people that is really, you're getting great results from.
And like I said, don't just take my word. Go to our website, preferredcare.com, and there's testimonies on there from patients, how much this has helped them and given them their life back. And it's just really amazing. So
if you're not already seeing someone or have a medical facility that you are committed to and you are looking for a new doctor, come on and give these guys a call. And if you want to keep your primary care doctor, that's fine, and come to us to treat your pain. That's fine awesome
too.
Thank you, Tarah.
Thank you
this was
for
really
having
great.
me.
I learned so much. I hope you guys did too. Enjoy the rest of your Wednesday. Remember, it is Wednesday. We lost a day with the holidays. So thanks so much.
Guys.
I'll be back with you next Wednesday. It's awesome. That's impressive.
PeoriaLife.com